Yes, hello everybody. So yes, as Christoph already mentioned, I would like to show you 3 of our applications.
Robert, I don't see your screen at the
Oh,
moment.
okay,
So
sorry. Let me change again the sharing. Thought I shared the PowerPoint.
nice to see you, but
Right. Okay, let's share the screen. Now better?
it's loading. Yeah, now I see it. Please go
Okay,
ahead.
sorry. Yeah, so first our app for the use at home called recoveriX at home, and then I will go into the gamification. We have 2 games, one for the upper extremity rehabilitation and one for the lower extremity rehabilitation. And yeah, more about that in a while. So just very briefly, in case you missed the introduction by Christoph in the morning, then of course I highly recommend you watch it again. But to give you an idea what is recoveriX very briefly in a nutshell. So recoveriX, our tool for neurologic rehabilitation for stroke and other diseases, measures the brain signals via the EEG. The user is receiving a task to try to move one of his extremities, hands or legs. The laptop computer classifies the motor imagery and detects if you're doing it correctly or not. And if it detects correct motor imagery, it switches on feedback devices, and we have a visual feedback device and functional electric stimulation, and both elicit the brain plasticity, which means you are quicker, faster in relearning, in shaping again your connections in the brain to relearn doing motor movements. So this is the timing within recoveriX. So you always get a task, try to imagine to move your hand or your leg. And the timing of one movement is these 8 seconds, as you see it here, where at second 0, there's a short attention sound displayed. And at second 2, you have the cue telling you which side to imagine, left or right. And then the feedback phase starts at 3.5 seconds until 8 seconds. There's the relax command where you can stop doing the motor imagery. And there's a short break in between, and then the next command starts. And this is randomized, but after all, the same number of left and right trials. And one session takes in total 3 times 80 movements. So you do 40 movements left, right, shuffled, short break, then again 80 movements total, and again, so this means one session takes 240 movements, and we do usually 25 sessions for rehabilitation. So 25 sessions times 240 movements, that's quite a lot, but that's necessary to have a good rehabilitation success.
Right.
So this is how the visual feedback usually looks like.
Relax.
And I hope you hear also the audio commands. So you get the
right
command to the motor imagery of your right hand, and
Relax.
you see the movement on the screen. And now it's the same for the left hand.
Relax.
And this is done for in total 240 times. If you rehabilitate the lower extremities, it looks like this. It's like you could imagine you would look into a mirror. You're sitting in front of a mirror, seeing your legs and your hands.
Right.
And the command is again to move the affected leg that you want to train, but also the opposite side hand.
Right.
So we always do one part of the left side of the body and versus one part of the right side of the body. So to rehabilitate the right leg, of course, the view is just flipped, so you would move the right leg instead of the left leg, as is here. So, yeah, guess this was mentioned already quite a lot. We are doing it to elicit the Hebbian plasticity that says that neurons that fire together, they wire together. This means if we present the feedback at the same time when you're doing the motor imagery, switching on avatar feedback and face feedback, and thus eliciting the afferent pathways back to the brain, you just strengthen the connections or the reconnecting of the brain and have a more effective training. So often patients ask us in the gym in Schielberg if there's something that they could also do at home. So you usually have maybe 3 sessions a week in our gym, or depending on the schedule, how often you come. And they also would like to do something at home. So this is why we created recoveriX at home. It's an app for Android and iOS, so you can run it on tablets and on smartphones, on iPad, iPhones, Android tablets, Android smartphones. Yeah, this would be the start screen. As you see already here, you get a subscription model, so you can try a 7 days trial period to try the app. After that, you would have to subscribe to further use it. And if you start it would look like this. So you can select the kind of paradigm, whether you want to train the upper extremities or the lower extremities and which one. So this is left leg or right leg. And you can select the language, of course. So you get, again, audio commands. So the visualization looks the same as you saw before, the avatar. Select the language. You can select the length of one session, 6 minutes, 9 minutes, 12 minutes. And of course, you can do as many sessions you want. And yeah, this is how it would look like on the smartphone, but it's the same as you saw before. I think we don't hear the audio here, but also they are the same, the audio commands. You also see the spotlight pointing to the hand, so this is an additional cue on which hand you should focus. And the same as I said for the lower extremities. So assuming you would have selected to train the left leg, then, oh, now we have sound again.
Left.
This ball, this magenta
Left.
colored ball is helping the patients
Relax.
in the visualization and trying to reach, to
Right.
lift the hand or the leg as much as to touch
Relax.
that ball. Okay. Enough about that. So to summarize, the recoveriX at home, it's thought just as a supplement to the normal recoveriX therapy. So it's not for people just doing recoveriX at home. It's for people doing active rehabilitation if they want to do more, if they are that much motivated, they want to train also at home. This is the way they can do it. You perform motor imagery and receive visual stimulation. Obviously, you don't receive functional electric stimulation because you need an expert to apply the electrodes for that. So only visual feedback. Yeah, and you can choose between hands and legs and have the session length of 9, 6 or 12 minutes. Pricing, as said, there's 1 week free trial to try it. And after that, there's also a monthly paying model or a yearly paying model. And in total, depending on your region where you are, the prices vary a little bit, of course, because of tax and whatever. But more or less, the cost is about 30 euros per year. And it's available in many languages. I don't read now all of them. I hope yours is one of them. And it's more or less available everywhere where the Play stores of Apple and Google are available. If you want to try it, here are download links. Don't worry, I show also on the last slide again these links. So you will have enough time to scan them. Now I would change to the gamification. So as I showed in the introduction, you do 240 trials per session, and this 25 times, or for multiple sclerosis, even 30 times, 30 sessions. So it can become a little bit boring to do always the same movements and always just see your hands or your legs moving. So this is why we introduced the gamification. To increase the satisfaction, the interest, the motivation, the compliance of the patients. But it's important to, if you want to keep the benefits of the embodiment, you should have the same kinds of movements as you do in the same in the original task. So if the task originally was to do wrist dorsiflexion, then also in the game it should be the same task, because otherwise it would be a different kind of training, and this is not what we want. So the challenge is to find tasks where you can do the same movements but within a game. And this is the one we created for the upper extremities. It's called Slap a Rat. I already heard some complaints about the name, but I can assure you no animals were harmed during development. So what you see here is again your hands in the first person's view and a pile of pieces of cheese in the middle. And there are two holes, two rat holes where the rat can appear. So this means it can appear from the left side or the right side. This means you have to imagine to move again either your left or your right hand. And your task is, if you see the rat, that you do a motor imagery, a wrist dorsiflexion to scare away the rat so it cannot catch one of the pieces of cheese. So let's start just the video so you can see how it looks like.
Right.
So you see here the rat appearing, and person is doing a motor imagery.
Relax.
And so it was a success. The rat was not able to catch a piece of cheese.
Left.
Same for the left hand.
Relax.
Again, a success.
Left.
This was
Relax.
not a success, so we couldn't do the motor imagery in time. The rat had one score. And yeah, this is the whole idea of the game. So for each piece of cheese, of course, the rat gets one score, and you try to prevent that as much as possible. We also have a game for the lower extremities where we have to move one of the legs and one of the hands. So this is how this looks like. We call it Drums Festival. So you hear kind of music, pieces of music, and your task here is to play your instruments in time, either with the left hand or in this case, right leg. Of course, this can be flipped to train the other leg. I will just start it. So you already hear the music and also the cue on which movement you should do is indicated by these notes and also by the spotlight. So you should do a motor imagery of your leg. And you saw here a person appearing from the backside. So this is a feedback about your performance. If you're playing well, if you're always hitting the instruments in time, then over time more and more people will appear. So the crowd will be just bigger and bigger, and they're all of course happy and listening to your music. If you would play not so good, if you would miss some beats, then it would be also that persons are disappointed and they would disappear again, go back to from where they came from. So this is an online feedback of how good you're performing. Can go a bit further maybe to see if we have another person. Yeah, here another one just appeared. Yeah, so another success and another spectator joined the crowd. Okay. We tested the gamification here on some persons to see the influence, if it's not maybe too distracting, if the accuracy is still good, and how do they like our games, of course. So we made this publication in Frontiers. First, we wanted to investigate if the control accuracy is not affected negatively, because it could be if there's too much distraction, you focus maybe more on the game than on the task, then maybe the control accuracy of PCI would decrease, and that's of course not what we want. So we compared this, so accuracy during the calibration with the standard avatar, and then the accuracy during the first session, standard avatar. And then we compared it with the second session and the 3 runs, the first 1 to 3 runs with game feedback. And yeah, what we see is that in total, especially here, the accuracy increased even a little bit. Here it first decreased, but after all, it even increased a little bit. So this means the control accuracy was not negatively affected by the games. And we also tested the user satisfaction. We tested it on healthy and stroke patients. Let them fill our questionnaire after doing a session. And you see here the sessions, the questions, level of fun, the visual aspect, yeah, sure, could be increased. I agree. Very important to me is the easiness of use was very high. Also the clarity of rules was good. And after all, they say that games are good ideas, has a high positive score. So to summary, using the games in your daily treatment, I would recommend for a new patient, you would start with the standard avatar, of course, doing some sessions, training sessions, feedback sessions, maybe 3-4 sessions, but then you could already switch, try one of the games, talk to the patient first, of course, what's his feeling about trying a game, and then if he's open to the idea, just give it a try, and then if the accuracy is good or similar as before, you can stick all the rest of the rehabilitation with the game. If the patient likes it, then it's good because as said, we made sure that the movement is the same, the timing is the same. 8 seconds, you receive the same as feedback, no matter if you use the game or the standard avatar. So there's no disadvantage in using the game. If they like it, just use it. That's it. Thank you. And yeah,
Thank
maybe
you
there are
very
some
much.
questions.
Robert Manuel wants to know if the fluctuating audience, more and less people depending on accuracy, if this is good because it's also a kind of punishment, and shouldn't you always motivate patients?
Yeah, we discussed it, but but and also we asked some patients. So in general, they're happy because all people or almost all people like a challenge and they know it's a game. So they see it really as a challenge. I want more people here. So and people liking a game, they like to have this kind of feedback. It's better than having no feedback. It's not good to, like don't be too careful. Just motivate your patients and give them a feedback. I think that's better for a good rehabilitation outcome. You can challenge them.
Challenge is super important, otherwise they're just sitting there and not doing anything. This is not what we want to have. They should actively do the 6,000 movement imaginations, and they're all eager to hear the classification accuracy every couple of minutes, and then they are upset if it's low and they are super happy if it's high. And there's a challenge running, who is the best patient here. And this is super important for engagement. You have seen the statistics above 80% leads to more Fulmeyer improvement. And this is, of course, why we are doing it. Upi, thank you very much.